Does arthritis hurt every day? Hey, this is Dr. P. Got a problem with your knee? Ask Dr. P. I got asked that question about arthritis. Watch this video for more information.
Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
No, it doesn't hurt every day for most people. Some people, yes. Some people, yes. Some people, no. The typical way arthritis usually works is this. In the morning, the person wakes up, and we'll just talk about the knee, for instance. So arthritis is when the cartilage on the end of the bone wears down. And so when that wears down, that can cause inflammation within the joint. It can also cause stress or microfracturing, soft spots in the bone, because as the cartilage wears down, more and more force gets transmitted to the bone underneath, and the bone starts to break down faster than the body can heal itself, and you get these stress or microfractures. And bone has millions of pressure-sensitive nerve fibers. So that is usually, when people say they have bone pain, I used to kind of not believe them, but that is what bone pain is. And that can be more constant. Not always, because it's definitely worse with activity, but that can be more constant, and that can be the pain deep down inside that people come tell you, I have this deep down bone pain. But usually, typically what happens is there's some swelling and stiffness in the knee, and when you wake up in the morning, it's stiff. It's stiffer than normal. When we all wake up in the morning, our joints are a little stiffer because we haven't been moving. But with an arthritic person, it's more stiff. When you get moving throughout the day, once you get moving, it doesn't feel so bad, and you start to forget about it. Then by the end of the day, you've been up on it, you've been beating it up a little bit, it starts to swell a little bit, it's sore, and so by the end of the day, it's usually sore and swollen. And by the time you get in bed at night, you're not thinking about anything else other than that, than that swelling and pain in your knee, and it hurts. And sometimes it causes people to not sleep very well. We have tons of people with arthritis who it doesn't hurt any days because we've taken care of them and gotten them to where they don't have any pain. So just because you have arthritis doesn't mean you have to have pain. Here's another great example. I see patients all the time, and they might say, hey, my left knee is killing me. And we'll get an x-ray, and it shows a little narrowing of that space where the cartilage is wearing down, but it's not bone on bone. Now, interestingly, we always get x-rays of both sides to compare, and you look at their other knee, and this is not infrequent, and it has worse arthritis, or it might even be bone on bone, and they have no pain in that knee. And they're like, oh, I don't have any arthritis in that knee. Well, you do, but you don't have pain in that knee. Why do I have pain in the other knee? Well, it might be some meniscus tearing, but a lot of times it's the bone. They have stress or microfracture in the bone, which you can't see on an x-ray. You can only see that on an MRI. I had a patient who famously had that exact problem, and I, at no cost, because we have our own MRI, I said, I'm going to MRI your other knee that's bone on bone and see if there's any stress microfracturing, because the one knee that had pain and didn't have a ton of arthritis had some significant soft spots or stress microfracturing in the bone. Interestingly, almost none in the knee that was bone on bone. So again, the bone tends to be what causes the pain with arthritis.